Recognizing the signs of fatty liver disease is crucial for early detection and management. Often, symptoms may be subtle or overlooked, making awareness all the more important. Here are 8 signs that could indicate the presence of this condition. 1. Unexplained fatigue. Chronic fatigue, a relentless tiredness that persists despite rest, can be a subtle yet telling sign of fatty liver disease. This type of fatigue is more than just feeling tired. It's an exhaustive state that doesn't improve with sleep or rest, marking a significant departure from one's usual energy levels. Often, this symptom emerges early in the disease's progression, making it one of the initial clues that something is amiss with liver health. However, because fatigue is a common symptom that can be linked to a myriad of less serious conditions, from everyday stress to poor sleep patterns, it's frequently overlooked or misattributed. This oversight underscores the importance of paying attention to persistent fatigue, especially when it's accompanied by other subtle signs of fatty liver disease. Recognizing this symptom as a potential indicator of liver issues is a critical step in seeking timely medical evaluation and intervention. 2. Abdominal discomfort. Mild to moderate discomfort in the upper right side of the abdomen is a frequent complaint among individuals diagnosed with fatty liver disease. This specific area of discomfort is significant because it aligns with the liver's location in the body. The sensation is not just a random ache but is directly tied to changes occurring within the liver itself, hinting at the underlying condition affecting the organ. The discomfort arises as the liver enlarges, a direct consequence of excess fat accumulation within the liver cells. As the liver swells, it stretches the capsule that envelops it, leading to the sensation of discomfort or pain. This stretching is a physical manifestation of the liver struggling to accommodate the increased fat, signaling the need for medical evaluation and attention to address the root cause of the fatty liver disease. 3. Weight changes. Unexpected weight gain or an unusual difficulty in shedding pounds may point towards underlying metabolic disturbances, one of which could be fatty liver disease. Such weight fluctuations are indicative of the body's impaired ability to manage and process fats efficiently, a hallmark of this condition. These signs are particularly concerning when they manifest without any notable adjustments in one's dietary intake or physical activity levels, suggesting that the changes are not merely the result of lifestyle choices. On the flip side, experiencing sudden weight loss without a clear reason, such as changes to diet or exercise routines, can also raise red flags for health professionals. While losing weight might initially seem positive, when it's unplanned and rapid, it may be symptomatic of the body's struggle to maintain normal metabolic functions, including those compromised by fatty liver disease. This paradox highlights the importance of monitoring and understanding body weight changes, as both weight gain and loss can serve as crucial indicators of health issues like fatty liver disease. 4. Jaundice. Jaundice, characterized by a noticeable yellowing of the skin and the whites of the eyes, emerges as a significant symptom when fatty liver disease advances, leading to compromised liver function. This discoloration is due to the buildup of bilirubin, a byproduct of the normal breakdown of red blood cells, which the liver is unable to process and eliminate effectively. The appearance of jaundice is a stark signal, highlighting the liver's inability to manage its essential detoxifying roles, which include filtering the blood of various wastes and toxins. The manifestation of jaundice as a symptom is an alarm bell signaling that the liver is under severe distress and is struggling to fulfill its critical functions. It serves as a visual and clinical cue for medical professionals to assess and address the underlying liver issues promptly. Recognizing jaundice's significance is crucial for timely intervention, as it not only indicates significant liver impairment but also the need for immediate medical attention to prevent further damage. 5. Swelling in legs and abdomen. Fluid retention in the legs, known as edema, and in the abdomen, termed ascites, are concerning signs that may suggest the progression of fatty liver disease to a more severe stage. These symptoms occur when the liver, compromised by excessive fat, struggles to perform its vital role in regulating the body's fluid balance. The accumulation of fluid in these areas is a direct consequence of the liver's impaired function, highlighting the organ's crucial role in maintaining systemic equilibrium. This condition indicates that the liver's ability to manage and filter blood, as well as its production of proteins essential for fluid balance, has been significantly affected. The presence of edema and ascites in patients with fatty liver disease signals a need for urgent medical evaluation and intervention. It underscores the liver's deteriorating ability to handle its physiological tasks, pointing to the urgent need for strategies aimed at halting the progression of the disease and restoring liver health. 6. Itchy skin. Chronic itching, particularly when it occurs without an accompanying rash or visible skin condition, stands as a less commonly recognized symptom of fatty liver disease. This incessant itching sensation is attributed to the buildup of bile salts within the skin layers. As the liver's ability to process and excrete bile is compromised due to the disease, these salts can accumulate in the bloodstream and subsequently deposit in the skin, causing irritation and discomfort. The presence of such itching is a subtle hint at the underlying liver dysfunction, often overlooked in the early stages of fatty liver disease. It serves as a crucial indicator that the liver is not performing its detoxification role effectively, leading to systemic symptoms such as this. Recognizing and addressing this symptom promptly can aid in diagnosing fatty liver disease early, allowing for interventions that target the root cause and help alleviate the discomfort associated with this condition. 7. High cholesterol levels. Elevated levels of cholesterol and triglycerides in blood tests are significant indicators of metabolic dysfunctions, which can encompass a range of conditions including fatty liver disease. When these lipid levels are higher than normal, it suggests that the body's mechanism for processing and utilizing fats is impaired. This impairment can lead to the accumulation of fat in the liver, contributing to the development of fatty liver disease. The presence of other risk factors, such as obesity, diabetes, or high blood pressure, alongside high cholesterol and triglycerides, further elevates the concern for this liver condition. The detection of increased cholesterol and triglyceride levels during routine blood tests warrants a deeper investigation into the individual's metabolic health, particularly focusing on the liver's status. It underscores the need for a comprehensive evaluation to identify any underlying issues contributing to these elevated levels. Addressing these metabolic dysfunctions early is crucial in preventing the progression of fatty liver disease and mitigating its potential impact on overall health. 8. Elevated liver enzymes. A routine blood test revealing elevated liver enzymes often serves as the initial hint pointing towards the existence of fatty liver disease. This elevation in enzyme levels is a significant indicator of inflammation or damage within the liver tissues. Such changes in the liver's enzyme levels are critical markers that healthcare professionals rely on to assess liver health and identify potential issues early in their development. The presence of elevated liver enzymes in blood tests necessitates further investigation to confirm fatty liver disease and determine its severity. This finding prompts healthcare providers to delve deeper into the patient's medical history, lifestyle factors, and possibly recommend additional diagnostic tests. Identifying liver inflammation or damage early on through these enzyme levels is crucial for implementing timely interventions that can prevent the progression of fatty liver disease and safeguard liver function. Diagnosing fatty liver disease. Early detection of fatty liver disease is essential for preventing progression and complications. Diagnosis typically involves a combination of medical history evaluation, physical examination, blood tests to check liver enzyme levels, imaging tests like ultrasound or MRI to visualize fat in the liver, and sometimes a liver biopsy to assess the extent of liver damage. Managing and treating fatty liver disease. Managing and treating fatty liver disease focuses on addressing the underlying causes and mitigating risk factors. This approach often involves lifestyle changes. Incorporating a healthy diet, regular exercise, and weight management can significantly reduce liver fat. Medications and supplements. In some cases, medications to control cholesterol, diabetes, or liver-specific supplements may be recommended. Regular monitoring and checkups. Ongoing medical supervision helps track the liver's condition and adjust treatment plans as necessary. Conclusion. Fatty liver disease can be a silent condition, but recognizing its signs early can significantly influence outcomes. By being aware of the symptoms and seeking medical advice promptly, individuals can take proactive steps toward managing their liver health. Regular checkups, lifestyle modifications, and treatment, when necessary, are key to preventing the progression of fatty liver disease and maintaining overall well-being.